let's say you were 51 and you were having terrible symptoms. You couldn't sleep, you couldn't work, your mood wasn't so good. You noticed recently that intercourse was uncomfortable. Then this is an individual decision, looking at all your personal risk factors and counseling you about your ability to function from day to day and the risks for someone in that age group with good otherwise blood pressure, good blood sugar, um, good weight, exercising with few cardiovascular risks. The risks are very, very minimal.
And when you say risks, what risks are those of?
Well, actually, there are probably cardiac benefits from taking hormone therapy in your 50s, although it is not approved for prevention of cardiovascular disease currently. But there is more and more evidence that if you initiate hormone therapy, we call it in the window of opportunity, which is in the 10 years after the last menstrual period, while your vessels are very healthy, that estrogen actually promotes vessel health. But currently, we are not advising hormone therapy to prevent cardiovascular disease.
What was interesting for me to hear you say is that hormone replacement therapy or hormone therapy, because that dosage is significantly lower than the birth control pill, but technically you could put me on the birth control pill, which actually is at a higher dose. Where does risk fall then between taking a birth control pill, which is much higher dose to sort of manage symptoms, versus a lower dose hormone therapy, and safety, given that, again, I'm not in that age 50 and higher? How do you make a call as a clinician?
So the first thing is as long as you're still menstruating, you can get pregnant. And hormone therapy is not a contraception. So when you give someone hormone therapy, they have to use additional contraception until they stop. So that's the first thing. The contraceptive pill, yes, it has more risk for clots, and we don't prescribe it for women who smoke or are at high risk for cardiovascular disease. But in general, the younger you are, the less risk there is for thrombotic complications. Um, and in terms of breast cancer, most of us and most of the studies that have been done don't really show a significant increased risk for breast cancer, although there may be a very minimal increase, but it doesn't appear to be a huge risk. So most of the diseases of aging accelerate after menopause.
Who should or shouldn't be taking hormone therapy if their number one concern is cancers, but specifically breast cancer risk? Is there anyone for you that right away you flag and you say, if you meet these criteria, maybe hormone therapy is not safe for you?
Well, there are some absolute contraindications for taking hormone therapy. If you've had breast cancer, it's not recommended. So that's if you actually have had breast cancer, not recommended. If you have abnormal uterine bleeding that hasn't been diagnosed, that's a reason not to start hormone therapy. If you've had a non-provoked clot in your leg or your lung, um, not recommended currently. If you've had a fresh myocardial infarction or stroke, not recommended to start hormone therapy. If you're pregnant, not recommended to start hormone therapy.
Mm-hmm.
There are some estrogen sensitive cancers that we would not prescribe hormone therapy for. If you have active liver disease, not recommended. If you have active gallbladder disease, we know that taking oral hormone therapy can increase gallbladder risk. Um, it's a bit of a discussion. If it's quiescent, it's probably fine. Transdermal being better than an oral therapy. So there are a group of people that we do not prescribe for.